Hi, my name is Dr. Firoz, MS ENT, head and neck surgeon and facial cosmetic surgeon. I'm a consultant in Germantown Hospital. We generally in ENT, people think of it's a small branch, but we deal with the ear problems like otitis externa, wax, and otomycosis, along with the CS1 where there is a perforation in the ear or any abnormality in articular chain, facial nerve palsies, and sinusitis, deviated nasal septum where there's a septum is deviated to right or left, and along with that polyposis cases, nasal polyposis, with that head and neck swelling like thyroid carcinomas and adenomas, along with that submandibular gland and parotid gland we include. And some of the cases we do for the skull base for like pituitary gland, we do surgeries for that also, and we do some facial cosmetic like facial lifting along with the blepharoplasty, along with lower chin double chin lifting, along with frontal lifting with botox and everything. Nowadays we have gained in there are a lot of changes in science, so we have developed any advanced equipments. Previously, we used to do the face with conventional method. Now we are using debrider. At the same time, for the tonsillitis, we are using coblation method for tonsillectomy, and physiotome for dissection of the septum and everything. So we would like to do advanced techniques for everyone, even for doing vocal cords. We are doing lasers and everything. Whenever available, we are applying the new sources of line of surgical management for the people.
German 10, German 10.